Thank you so much for inviting me to be here today to share these important map resources that will hopefully prevent opioid overdoses in San Diego County. As Marla mentioned, I am the Media and GIS Director at the Institute for Public Strategies. GIS, just so you know, it stands for Geographic Information Systems. And I use GIS to analyze and visualize the relationship between location and health to help inform decision making that really creates healthy, safe, and equitable communities. I am also the co-chair of the SUOPT Safe Disposal Committee, along with Kelly McKay with the Drug Enforcement Agency. And just also kind of give you a heads up, this presentation is actually divided into two sections. The first is going to be, we're going to talk about these resource sharing web apps. And then also the second part will be applying a lens of social vulnerability on opioid resources in San Diego County. But first of all, to begin, these map resources are the result of a collaborative process that involves several agencies, my own, IPS, the County of San Diego, SUOPT, the Drug Enforcement Agency, and then Family Health Centers of San Diego. So I just want to make sure that they are given the proper recognition that they need because it really has been a collaborative effort. So as Marla mentioned, this project actually started about 5 years ago, and some of you may have already seen this timeline before in another presentation, but I'll just quickly kind of run through how we got to where we are at today. It was kind of like a combination of, the issue that Marlo was explaining about the flyers. And then also at the time, Nick Machione was saying, gosh, how nice would it be if I could just look up on a map where all these prescription drug drop-off boxes were located. And around that time, there's a lot of conversations within the GIS field about how to use it to address the opioid epidemic and providing maps of where these prescription drug drop-off boxes were located and that they could be a key protective factor in preventing, misuse of medications. Excuse me. So our map started off with just the drop-off boxes, and through the collaboration with the County of San Diego's Business Intelligence Unit, we added some MAT locations in October 2021. And, kind of like through fits and spurts, because of the pandemic, it was kind of a slow process getting things added and the apps actually developed, but we finally did. We officially launched it on Prescription Drug Take Back Day at a media event in the spring of 2022. And then later that year, we access to Naloxone was expanding within San Diego County. So we added those as well. And with the help of Katie Wood at Family Health Centers, she coordinated the gathering of data on the drug Medi-Cal programs, the federally qualified health centers, and California Bridge program locations. And we added those to the map as well. What happened though was that the one map became too busy with all of these different resources on there. So we decided to kind of split it up into two, one just for the drop-off boxes, and then another map that had the harm reduction and treatment resources on there. And so we're continuing to add these resources as we get them in. It's a, kind of a QA process that we go through. We try to go through at least twice a year around each DEA sponsored Take Back Day. So that's kind of where we are at the moment with this map. And so here's a screenshot of the prescription drug drop-off locator map, and I'm going to take us there directly. Can everyone see the actual map? I'm hoping. So I am going to put in my address, 85 Rio, San Diego. Kind of takes a little bit of a while for it to pop up there. And this red pen here in the middle of this circle represents my location where I'm at. And I have it set at a 5 mile radius, although I can reduce the radius as much as I want. I can increase it as much as I want, whatever parameters I want to put in there. And then I will see that there are 37 drop-off location boxes that are within my 5 mile radius. And it'll bring up this table that has, the location, the hours of operation, if they accept sharps. It'll also have a link to the website as well as a link that will take you to Google driving directions. And so you can just click it in and it'll give you the driving directions to go straight there. Additionally, I can click on like any one of these, the pill icon here in the map, and it'll give me the information for this specific location. So this is the Sheriff John Duffy Administration Center, and it'll give me this exact same information in this pop-up window as it does over here. So I'm going to clear that search location, come back over here to the information page. And over here, we have a link to the SUOPT webpage that has the report cards in there. So the most recent one that they have is the 2024 report card, which is data, I believe, 2023 and sooner for some of the measurements. But the 2025 report card, just so you know, keep an eye out for this, will be released October 21st at a media event coming up in a month. So I'm going to come back over here to my web app. We also have the phone number for the access and crisis line here. We want to make this kind of like a one-stop shop, if you will. We want to give enough information to people who are accessing these web apps without giving them overwhelming amounts of information. So we just want this to be very user-friendly and accessible. And then we also have a link here that takes it to the second or its sister map, which is the one with the naloxone and Medicaid, the MAT centers on there as well. One future enhancement that we would like to do is to include is to make this more accessible to our diverse language populations within San Diego County. So we have the capability of translating this map into other languages, excuse me. And so Spanish would be the next logical one for this map. So that would be a future development coming down the line. So I'm going to come back over here, advance my slide, and now this is a screenshot of the substance use and medication assisted treatment resources. I'm going to go into that map. Same concept here. I can put in my address and it'll put a red pen down on the map where I'm located. I can adjust the radius to whatever parameter I choose. This one also has a link to the SUOPT report card, and it has just a little bit more information about MAT resources, about naloxone. Also here we have YouTube videos that are training videos in both English and Spanish about how to administer naloxone. We have also added information about California Bridge programs. These are the emergency departments that treat opioid overdoses and kind of do like a handoff to other sources of counseling and treatment and what have you. So, and then here, excuse me, is our legend that tells you what each of these icons stands for. Again, also the phone number for the access and crisis line, and then a link to the first map that I showed you. I'm going to, oops, let me do that. I'm going to kind of scroll in a little bit and show you, well, if my, let's see. So I'm going to pull up one of the MAT centers. and this pop-up here. And so also in addition to the name and the address, we wanted to really give users an understanding of what is accessible or what is offered, the services offered at each of the locations. And so we had the medications that they are administer, the populations that they serve, also the hours of operation. Not every MAT center caters only to adults. Some also are for youth serving centers as well. We wanted to make sure that information was conveyed. Website, and then also, again, to keep this as accessible and equitable as possible, if they offered, like for instance, Spanish or other language interpretation services, we wanted to make sure that users had the capability of understanding what was available and also directions. And again, a future enhancement would be to provide these maps in different languages to serve our broader San Diego County population. Let's see, before I move on, I just want to double check if there are any questions or comments or anything about the two maps that I showed. All right, so we will move on. Advance to the next slide here. So here are where the websites where these resources reside. So primarily on the San Diego County Behavioral Health Services webpage here. You can go and see both of these maps are here. We also have links on the SEOPT website as well as the 211 website. And then here is just a QR code if you want to quickly snap it and take a look at it, how it renders on your phone or on your tablet. You can do that through this QR code. So what's next? It's great that we have these resources, but what's the point in having them if no one knows about it, right? So here, I guess, is kind of our ask of everyone who is on this in this virtual room here. Help us spread the word. Put information about this on your flyers or your brochures. Tell your clients or maybe the providers you work with about this incredible resource that we have. Post some stuff around on social media, especially around prescription drug take back day. I'm happy to provide the QR code or anything like that that will help enable you to put this stuff on your materials. Talk about this if you're a part of a community coalition. Talk about these resources at your tabling events, and then just of course through word of mouth is always a great resource as well. If anyone else has any other suggestions, please feel free to, well, I'm not sure if the chat is enabled, but please feel free to share them with us. I've got my contact information at the end of the presentation. So now I'm going to pivot to the second part of the presentation, which is applying that lens of social vulnerability into where these opioid-related resources are located within San Diego County. So at a fundamental level, having access to the prescription drug drop-off boxes is a primary deterrent to opioid misuse. Let's get them out of the medicine cabinets, and let's just make sure that no one has access to them for kind of, nefarious reasons or uses. And then the availability of naloxone is obviously critical in preventing overdose deaths. Having that, that resource there, that medication to, really like revive people back is super important. And then finally, the MAT Center's whole patient approach, which encourages patients to be active participants in their health care and empowering them to be more knowledgeable about and responsible for their health and medication use, is also super critical in preventing, more opioid overdoses. And it's important to know how readily accessible these resources are, especially among groups or individuals who, due to various demographic or socioeconomic factors, face a higher risk of experiencing substance use disorders and have limited capacity to either prepare for, respond to, or recover from these events. And some of these factors can include things like poverty or a lack of access to resources like healthcare or transportation, or crowded housing. Just think about like the overall social determinants of health. Those non-medical factors that have some sort of influence on our health outcome, behaviors, and outcomes. So the maps are all well and good again, but how do we know how effective these resources are in getting into the hands of the people that need them? So I asked the question, are harm reduction and treatment resources where they need to be in San Diego County? That's the question that's driving my analysis. And so, as seen in this quote, it underscores that when resources are absent, it has dire consequences to both the person and to the community. So that's why this analysis is very important to determine. So I wanted to find out if the following tenets were true. Resources are located where people can readily access them. Resources are located within a reasonable driving distance, and the most socially vulnerable populations can readily access these resources. So for my methodology, I used ArcGIS Pro and ArcGIS Online software. That is pretty much the premier GIS software that's used in all different industries, not just public health and healthcare, but transportation, technology, government, military. It's everywhere. I had my locations on a map of the prescription drug drop-off boxes, naloxone resources, and MAT centers. Those I directly downloaded from the web apps that I demonstrated previously. And then I added data layers, other data layers, which include the percent of households with no vehicles available, the percent of the population below the poverty line, to again give that lens of social vulnerability. I developed 10-minute drive time buffers around each of my resources. And then I also included another layer, the CDC Social Vulnerability Index. If you're not familiar with that, it's a tool that was initially designed to help identify communities that may need extra support before, during, or after disasters or public health emergencies. But it's actually been expanded in many different ways to visualize vulnerable populations just on a day-to-day basis without even having those emergencies in play. On the flip side, I like to think of it as useful to emphasize resiliency of these communities. It's not just about, you can have a vulnerable community, but you can also have vulnerable communities that are also working towards resiliency and building that up. So here is my web app with all three of my analyses, and I'm just going to kind of go through them one by one systematically, so hopefully it's not very confusing. Here are my layers. So my first one I'm going to start with is analysis one. Resources are located where people can readily access them. And so starting off, I'm going to turn this layer off. Again, I'm trying to do this systematically so it's not into step by step, so it's not confusing. So here I have my prescription drug drop-off locations, naloxone resources, and MAT centers around the county. I am going to add this layer of census tracts with a high percent population that do not have a car. So kind of take these off. So you can see these census tracts. These are census tract polygons. And within all of these census tracts, greater than 50, sorry, the majority of the population does not have a vehicle, or a large portion, I should say. A large portion of the population does not have vehicle access. So that makes it more difficult, right, to get to these resources if they don't have a way to get there. Transportation is a part of that social determinants of health, as far as like the neighborhood built community. How else are you going to get to a grocery store or to a pharmacy or, someplace like that if you don't have a car or if you don't have like if you're not on a bus route or something like that. So vulnerable populations here are defined by those that don't have access to a car in order to get to these different locations. Bear with me for a minute. We'll get to the results part in a second. I just kind of wanted to go through the analysis first. All right, so I'm going to turn that one off. So I'm going to go to analysis 2, which is resources are located within a reasonable driving distance. I'm only going to show prescription drug drop-off, the analysis I did with the drop-off boxes, although I could, do it with naloxone and MAT centers as well. So these polygons here represent 10-minute drive times from each of the prescription drug drop-off boxes. That means that if there's a point within a pink polygon here, that means that the driving distance is within 10 minutes. I'm going to overlay that with census tracts that are heavily populated within the county of San Diego. And that's identify the metric for that, or the benchmark for that, is where the population of the census tracts is more than the county average for San Diego County. That's what defines a heavily populated census tract. So these purple bluish census tracts here are where the population density is quite high. So when I overlay that with where these 10-minute drive time buffers, there's some patterns that are emerging here. We've got polygons, heavily densely populated polygons up here. This is Camp Pendleton, so that might be a little bit of an outlier. But around here, there's the people do not have access within 10 minutes in this area. Like, this is sort of like Palo Reservation area. Again, maybe an outlier. But if you come down here and look, like Miramar's down here, this is Scripps Ranch. This is a very suburban area down here. And there are no 10 locations that people can drive to within 10 minutes to drop off some unused medication. So possibly this is a good place for some action to happen and putting some more drop-off boxes within those areas. Same thing going down here. I'm pretty sure these are outliers. These are like way out in East County. But if you look in National City, Chula Vista area, there are quite a few polygons. Again, these are ones that are not overlapped by the pink ones, where there's just not accessible within a reasonable driving distance. Before I move on, any questions about that? I hope that it at least visually makes sense. Again, if you have any questions, I'm available to answer any. All right, so let's go to analysis 3, which is the most socially vulnerable populations can readily access these resources. Let me come back to San Diego County here. Oh, I'm turning off that layer for just a second. So here we have our naloxone locations around the county. These are all the ones that free naloxone, I should say. This is where free naloxone is available, as well as the vending machines. So I'm adding a layer that says census tracts where a large part of the population is below the poverty level. So, again, locations where naloxone is accessible is important, because you don't want to have to, they have to be there and accessible, like in a healthcare clinic or someplace that they don't have to drive too far to get to. So we look at poverty level because they are the population least likely to access these healthcare resources, including harm reduction. So just so you know, so again, these polygons represent census tracts where the large part of the population is below the poverty level. Now I'm going to turn on this layer. And these are census tracts where a large part of the population is below the poverty level, and they have they have no naloxone resources, do not have naloxone. So I'm going to zoom in here to for a better visualization to again National City and Chula Vista. So you see there's naloxone here, here, here. But there's no naloxone within these census tracts where there's quite a bit of poverty going on. And so, again, that's an opportunity for intervention. Maybe we need to add some more naloxone resources in these areas to kind of make things a little bit more equitable and accessible to populations that are experiencing poverty. Another metric, again, going back to the CDC Social Vulnerability Index, this index includes things like poverty, but it also includes other metrics like race, ethnicity, household characteristics, income, other socioeconomic measurements. It kind of like collapses it into an index with and gives each census tract a score. So this is just kind of like a broader interpretation of the layer that's just focused only on poverty. But again, still we're seeing the same pattern here down in San Diego, South Bay, and border region is that, yeah, there are resources for naloxone, but we could certainly expand it down here to say, for instance, San Ysidro, maybe some more up in National City. Okay, so I am going to come back to my presentation. So here are the results. For analysis one, resources are located where people can readily access them. This is what my analysis found was that 11% of San Diego County census tracts have a population in which 12%, which is the county average or more of the population, do not have a vehicle. Within these census tracts, 17% have prescription drug drop-off boxes, 13% have naloxone resources, and 43% have MAT resources. So again, just to, these again, just to kind of articulate these polygons here. These are the polygons that in which there's a large part of the population that does not have a car. And so, which they represent 11% of San Diego County. These green polygons represent 11% of the San Diego region. And by all intents and purposes, when we say a large part of the population, that means like more than the average for San Diego County. So that's what we have here. Analysis two results. Resources are located within a reasonable driving distance. So our catchment area, which is where the driving distance to a prescription drug drop-off box is 10 minutes, represents about 20% of San Diego County. And even though some census tracts are heavily populated, for instance, again, like showing up here, around here in this area in East County, around Scripps Ranch or east of Miramar, and down here, you can't really see it, but like around San Ysidro, there's census tracts that have a high population, but there are no prescription drug drop-off boxes within a reasonable distance. And then finally, our analysis three results. The most socially vulnerable populations can readily access these resources. So looking just simply at the poverty line, this is what our map looks like for the county of San Diego. And so this is just a static picture, so you can't really see, but if I bring in a zoomed in version of National City and Chula Vista or San Diego South Bay, we do see that yes, there are naloxone resources here, but there are still these census tracts that are shaded in blue that do not have naloxone resources. So again, potentially areas for intervention. So with all research questions, there is usually a discussion, and are San Diegans sufficiently served by the harm reduction and treatment, I should also say treatment, resources that are available? Well, that's a That's a decision that's based on whatever benchmarks we deem as being acceptable. I don't know what that benchmark is, though. That requires a whole different um, discussion that brings into many different perspectives. Like, what is that benchmark? Are we happy that, only 11% of the population or 12% of the census tracts have high populations with no vehicle access? Is that acceptable or not? I don't know. That's a broader conversation than what I'm presenting here, but it's something that we have to think about in terms of availability and where our resources are, and are we making them available to the ones that are the most vulnerable? And then what else can we do to make these resources available? And I'm opening this up. I don't know if the chat is open or if anyone has any suggestions or anything to share with the group. Would love to hear from you all who are very intimately familiar with this population and this topic.
I do see some questions, Meredith, and thank you for a great presentation. I'll go ahead and read the questions, and then the entire group attending can hear the answer.
Sure.
Is there any concerns of an individual putting in their address? And I know they don't necessarily put in their address, they put in their zip code. So can you explain and expand on that, please?
Sure. So let me come back here. So I'm assuming that you're talking about our maps here, correct?
Mm-hmm.
So you don't have to put in your exact address, but it's probably no different than like, putting in your address in like Google Maps. As far as I understand, there are no data. I mean, well, there's always, I guess, going to be data vulnerabilities, right? But it's probably no more, no less than like putting it into Apple Maps or Google Maps or anything like that. But you don't have to put in your full address. You can just put in 92010. You can put in a zip code. You can put in neighborhoods, for instance. You can put in like North Park, San Diego. You kind of want to see what populates here. It does use this geocoding service. You can put in North Park and it'll pop you up there. You can, I think you might even be able to like put a pen. So let's say if you're like at Lake Murray, maybe you can't put a pen. That'd be a good enhancement. Like if you just want to put a pen down and then create your radius based on the pen that you choose, that might be an enhancement, future enhancement as well. Thank you for that question.
Let me finish typing up this question, and then I can share the next question with you. Somebody had asked that they have been a mat distributor and provider for many years. The neighborhood healthcare has provided MAT for about 8 years, which is wonderful. Thank you for the work you do. And we have harm reduction and naloxone vending machines. How do we identify on these maps? So how does an organization participate? Can you share that, Meredith, please?
Sure. And thank you. That's probably that's a very good question because this is what part of our QA process that we do, twice a year is that we want to make sure that we are giving San Diegans the, most accurate information that we can. My suggestion to you, so I'm kind of the curator, if you will, of the MAT and naloxone resources. Kelly McKay with the DEA, she's the curator of the prescription drug drop-off boxes. So for the MAT naloxone ones, let me take you here to my last slide. Sorry if you don't get dizzy as I'm scrolling through here, but I wanted to bring you to the slide that has my contact information. Those are my references. here is my contact information. Take a picture of it, screenshot. Please email me with the information. If you, what we would be looking for would be the name of the center, the address, your hours of operation, the types of medication that you administer, if you have language interpretation services, and the demographics, like the age demographic of the populations that you serve. You can look on the web map and get an idea of, and go to like click on one of the icons that represent a MAT center, and it'll show you the information that we provide up there. And you can just email that to me, and I'm happy to add it to the map.